Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning in to my latest video. So, the patient who attended with bilateral sticky glutinous earwax in both ears. We're starting off in the left ear. Now, the patient presented with the following symptoms. So, of course, reduced hearing, tinnitus. So, tinnitus is a noise. It could be any noise, but most commonly it's a ringing or hissing or whooshing or ringing noise that originates within the ear or the head and not due to any external sound or stimulus. They also suffer from oral fullness. Oral fullness is a sensation of pressure inside the head, and another condition called autophony. So autophony is when you can hear your own voice a bit louder. And we've managed to clear the left side. That was pretty straightforward. The left side was, I would say, semi-occluding or 3/4 occluding. It wasn't fully occluding like the patient's right ear is, and you'll see that in a moment. Because it's quite a sticky, syrupy, glutinous type of wax, there's some residual wax just at the entrance of the ear canal, and I'm just using a Jobson horn just to gently, I don't like using the word scoop, but gently just massaging it off the canal walls. There's the patient's eardrum, nice and healthy. So we're now on to the right side. So the right ear is a lot more occluding. You can see this glossy appearance. So the glossy appearance generally means there's some keratin in there as well. So 60% of earwax is made up of dead skin anyway. But near the entrance there, you'd see it's a lot more glossy. When you've got sticky wax, so wax is made up of many different organic compounds. I'll just explain that. But as I'm explaining that, you can see that I'm just using a Jobson horn. I'm going to go back in with a suction probe to perform microsuction. I'm going to revert back to the Jobson horn a bit later. So earwax consists of 3 primary substances. Dead skin, as I mentioned, about 60% of earwax is made up of dead skin. The remaining 40 is a combination of sebum. So sebum is an oily, fatty secretion. It's the same oily, fatty secretion we find on our scalp. And sebum is made up of also, so the subcomponents of that is cholesterols, fatty acids, chains of saturated fatty acids, should I say, to be more specific, squalene. So they're the kind of the general components of sebum. I think I mentioned cholesterol, but if not, I'm just going to put that out there again. And it's also made up of an oily sweat. It's the same sweat secreted under our armpits, and they're due to modified alcoporin glands. And I feel as though when you got a sticky consistency of wax like this, it's due to a higher composition of cholesterols within maybe the patient's diet. So their sebum, as I said, a sebum is a cocktail of ingredients. So again, I'll just repeat those: so alcohol, squalene, cholesterol, chains of saturated fatty acids. And it could be that sebum is a bit more consists of a bit more cholesterol, high composition, and you get the sticky wax. So I've just removed the outer lateral part. This is the more deeper part. So I'm giving it a good wriggle there. And when you've got wax like this, you've got to be careful because it just can easily block the tip of the suction probe, and it means that I have to keep going in and out of the ear to use it. We've got a cleaning rod, so if the suction probe gets blocked, it's a little rod that we just thread through the suction probe, and it just pushes and forces along any trapped earwax inside, so it travels down the suction tube. So I brought it near the entrance, but it wasn't going to come out anymore, so I reverted back to the Jobson horn. I'm just trying to get in and behind this and slowly massage this and manipulate it, extract it forwards. Got to be careful that we don't embed the Jobson horn too deep into the wax, so the tip of it makes contact with the base of the ear canal, because you can quite easily scratch and graze the ear canal. So as I removed that chunk, it detached itself from the main body because the entrance is a bit narrow. So I've just gone back in with the Jobson horn. You can see how slowly I'm doing it, because I'm trying to get as much out in one scoop as possible, and the slower you do it, you're making use of the surface area of the Jobson horn, and you can trying to keep the mass of the wax together as opposed to dissecting through it if you move quickly. And I think that's the main body. Let's have a look. Lovely, healthy textbook eardrum. And it's an amazing view. The endoscope's hardly in the ear. It's just at the entrance, and we've got a fantastic view of the eardrum. So just using the Jobson horn again, the correct, just to remove some of that sticky wax off the canal wall, just like I did in the patient's left ear. Patient noticed an immediate alleviation of their symptoms that I described at the beginning of the video. See, just a bit of wax there. Just that's on the cartilaginous portion. So just using the Jobson horn just to gently peel it off almost. Scoop it off. And again, I don't really like using the word scoop, but I can't think of any other word. And we're just going to go back in a moment and have a final view. So I hope you enjoyed that video, guys, and you're all keeping well and safe, and stay tuned for some more videos.